Camacho, a second-year nursing student, and in this video, I'll be demonstrating the catheterization for female patients. So first things first, we have the assessment. First thing that we have to assess is her overall condition, which includes her consciousness and her ability to participate with the procedure. Next is to determine when was the last time that our patient has voided or urinated. Then we percuss the bladder for distension and fullness. Next is to assess the external female genitalia for redness, any kind of skin breakdown, excoriation, the odor, and even the discomfort of the patient. Next is to assess for any kind of discharge and drainage and tenderness from any localized area. The next we have is the planning. So it is our responsibility to always verify the physician's order before any conductive procedure. Then we prepare the client and the materials for this procedure. And as far as you can see, I don't have here a real patient, but ideally the position of the patient should be supine with their legs extended and slightly abducted. And the rationality to that position is that to have easy access to the urethral meatus and to successfully perform the catheterization. After introducing yourself to the client and identifying your patient's identity by letting them state their name, we then explain the procedure and why it is necessary for them to cooperate, because it might be that the physician has ordered catheterization because the patient's bladder is distended or there's a need to obtain a urine specimen. Then, we tell our patient honestly that during this procedure it might be painful, but it can be tolerated or it is tolerable. Next is to provide privacy by drawing the curtains and closing the doors, and by draping them properly, exposing only the female genitalia. And to formally start with the procedure, we perform hand hygiene. Adequate lie, make sure that if you're right-handed, you're standing on the right side of the client and vice versa. If you're left-handed, you stand on the left side of the client. And to start with the procedure, we wear our sterile gloves. So basically this side over here is the sterile field, and while inserting the gloves, make sure to maintain the sterility. And then you can dispose there in one area in an unsterile field. Okay. You can use your left hand so that you can insert your gloves. And you can just... So after you have wear your gloves, you're already sterile, so make sure that you're not touching anything. Next thing that we do is we drape our client a waterproof pad under the buttocks of our client, making sure that we're not gonna touch anything. A fenestrated drape, exposing only the female genitalia. Right there. After placing the waterproof pad and the fenestrated drape, we will now proceed with cleansing the meatus with a cotton ball using the forceps. So with your non-dominant hand, we're going to use it to spread the labia, while your sterile hand uses, the sterile hand is used to pick the forceps, used to pick the cotton ball with the forceps. So we're just going to firmly spread the labia with your non-dominant hand. The moment it touches the labia, it is now contaminated and becomes unsterile. So we're just going to use that to spread the labia right there, and we're just going to get the forceps and pick a cotton ball. So the technique in cleansing the meatus is from farthest to nearest in an antero-posterior direction. So first we're going to wipe the left side, which is farthest from me, up to bottom, right there. And we're going to use another cotton ball. We will be using a cotton ball for each side. So nearest to me, which is the right side, top to bottom, right there, and in the middle, top to bottom, right there. So after cleansing the meatus, we will now proceed with the insertion of the catheter, and I will just want to mention that the size of the catheter for female is French 12 to 14, and the length of the insertion should be around 3 to 4 inches. So I will start with holding the catheter as if I'm holding a pen. So like that. And ideally, the tip of the catheter should be added with lubricant. But since I don't have one, let's just say that I already did. So with your non-dominant hand, we're going to use that to still spread the labia, to expose the urethra, and to properly insert the catheter in the urethra. So this is the time when we will now be instructing the patient to inhale and exhale. As she inhales, it serves as a distraction, and as she exhales, that's the time when we insert the catheter. So ma'am, can we inhale, exhale po? So we're going to insert that at the urethra. And you will be feeling resistance, and that's okay. We will just continually instruct the patient to inhale and exhale. Exhale po. Like that. So after inserting around 3 to 4 inches, and you have observed a urine flow, that's the time that we will furthermore advance around 1 to 2 inches to properly anchor the balloon. After advancing around 1 to 2 inches, we will now be inflating the balloon with your sterile hand. We're going to inflate that with the 10 ml. Like that. And you will feel a resistance. If there's a resistance and the balloon and the catheter doesn't come out or move, it means that the balloon is already anchored at the bladder. Now that we have successfully inserted the catheter inside the urinary bladder and that it is properly anchored, we will now place the collection bag just below the hip, so to prevent ascending backflow, and make sure to tape the tube at the inner thigh to prevent tension and pressure in the urethra, because that area, the inner thigh, if we tape it there, it is less mobile and it is easier for the patient, or it is more comfortable for her. So we're just going to tape that at the inner thigh and place the collection bag just below the hip at the bed frame, not the bed rail, because bed rail tends to move. Before taking off my gloves, I will be removing first the drapes and the pads and the sheets. Throw that to the bin. removing the gloves. Right there. After proper disposal and removal of gloves, we will now be assisting our patient to a comfortable position. We will be draping them and cover the genitals. And after that, we will be documenting the catheter procedure, which includes the date and time, the catheter size, the client's reaction, the characteristic, and the amount of urine. So this is the end of the video. Thanks for watching.